Hello, we're from Multitech Solutions, and today we're going to be talking to you about viral infections and their associated symptoms. Specifically, we're going to be looking at the hepatitis C virus. This virus infects 2 to 3% of the world population. That's 175 million people in the world. The acute symptoms of this disease include fever, fatigue, loss of appetite, vomiting, abdominal pain, and joint pain. Symptoms usually appear about 6 weeks after exposure to the virus and can vary from one individual to another. However, a majority of the infected don't show these acute symptoms of hepatitis C. They can live a normal life completely oblivious to the presence. So what's the big deal? This virus can hijack your lipid metabolism. Now that can get serious. But what is metabolism?
Metabolism incorporates all processes within cells of living organisms to facilitate growth, reproduction, and the maintenance of biological structures in response to environmental changes. These tasks require a constant supply of energy that is created through metabolic processes. The food we digest is broken down to macromolecules that drive the formation of these high-energy chemical bonds, typically through the addition of a phosphate group to form adenosine triphosphate, or otherwise known as ATP. ATP is the penultimate unit produced and subsequently used by the body. Our diet consists primarily of 3 macromolecules: carbohydrates, proteins, and lipids, which is also known as fats. The body is very efficient and only uses resources it needs at any one moment. During exercise, carbohydrates are broken down through glycolysis, pyruvate dehydrogenase, and the citric acid cycle. Now, after a big meal, carbohydrates provide a lot of glucose to the body. The extra glucose floating around in the blood can be stored as glycogen for future moments that require immediate ATP production. If we have really chowed down a big meal and our glycogen stores fill up, then the excess carbohydrates are converted into lipids through a process known as fatty acid synthesis or lipogenesis. Lipids are then stored in fatty tissues known as adipose tissue. But while carbohydrates produce adequate ATP, lipids are the kings of ATP production. In fact, lipid stores can provide energy for up to 2 to 8 weeks, depending on how much body fat you have. Lipids are broken down through a process known as beta oxidation. Both fatty acid synthesis and beta oxidation occur in the liver. Unfortunately, drastic changes in our lipid metabolism occur because the hepatitis C virus targets primarily our liver, where it established conditions favorable for its replication.
The hepatitis C virus is a single-stranded RNA virus surrounded by a protein-lipid envelope belonging to the virus family Virology. The single-stranded RNA codes for a polyprotein composed of core and structural proteins at the N-terminus and non-structural proteins at the C-terminus. The core is largely responsible for liver damage and contains 2 domains, D1 and D2. D1 comprises 2/3 of the core protein, while D2 is the bottom third of the core protein. D2 plays a vital role in the virus's reproduction. Its structure consists of 2 amphipathic alpha helices connected by a hydrophobic loop, contributing to interactions with hydrophobic lipids. Though there are many important non-structural proteins encoded by the viral genes, several of relevance include NS3, NS5A, and NS5B. We will soon elaborate on the role that these proteins play. Hepatitis C is only transmitted from the blood of an infected individual to another. Upon infection, the virus circulates in the bloodstream and remains largely undetected by the immune system for the initial few weeks. The first line of defense involves our innate immune system, characterized by macrophages, neutrophils, dendritic cells, and natural killer cells. It seems as though hepatitis C is able to suppress the maturation of natural killer and dendritic cells, thereby diminishing the immune response. After 6 weeks, the development of acute hepatitis C symptoms correlates with the appearance of T cells and B cell antibodies in the bloodstream, which constitutes the adaptive immune response. In order to proliferate, the virus must target liver cells, known as hepatocytes, where it can hijack our lipid metabolic pathways. This liver infiltration bolsters the immune response. Collectively, exogenous viral factors and endogenous immune factors contribute to the appearance of acute viral symptoms.
Even though the immune system constantly attempts to remove the hepatitis C virus from the liver, it fails to do so in approximately 60 to 80% of cases. However, it is possible that patients develop chronic illness and display no visible symptoms. In fact, some patients go 20 to 30 years without showing symptoms, even though they are infected. To be infected, the virus enters the liver through a process known as receptor-dependent endocytosis, in which the envelope proteins of the virus fuse with the membrane of hepatocytes. The fusion of envelope proteins triggers the release of the RNA strand into the cell. Once RNA is inside, the virus takes advantage of the host cell machinery to perform its replication and translation. It appears that the virus initiates the formation of membranous webs throughout the cytoplasm, on which replication is thought to occur. This is supported by studies demonstrating the localization of non-structural viral proteins to these structures during replication. At these sites, the hydrophobic lipid droplets aggregate and the hydrophobic D2 domain of the virus interacts with the lipid droplets. A prominent chronic symptom of HCV infections is liver steatosis, known as fatty liver, which is created by the huge change in lipid metabolism. One way the virus alters lipid homeostasis is by enhancing lipogenesis. Lipogenesis, or the generation of lipids, is regulated by 3 transcription factors widely considered to be the master regulators of lipid metabolism. These structurally related proteins are SREBP1A, SREBP1C, and SREBP2. Hepatitis C upregulates these proteins, leading to increased lipogenesis. Studies in transgenic mice have revealed that SREBP1A overexpression upregulates acetyl-CoA carboxylase and fatty acid synthase, which are enzymes essential for fatty acid synthesis. Acetyl-CoA carboxylase catalyzes the reaction of acetyl-CoA and bicarbonate, producing malonyl-CoA, which is the main substrate for fatty acid synthase. It has been observed that increased SREBP1C upregulates hexokinase, presumably to convert glucose into acetyl-CoA, the precursor for fatty acid synthesis. Furthermore, SREBP2 as well as SREBP1A upregulate cholesterol biosynthesis. All things considered, the abnormally high levels of fatty acids results in the formation of lipid droplets to store the abundant triglycerides. The presence of lipid droplets creates an optimum environment for viral replication. The association of the viral coproteins with lipid droplets is absolutely essential to recruit other viral proteins for viral production. The NS3 and NS5B non-structural proteins form a replication complex located on endoplasmic reticulum-like membranous webs. When the D2 domain and lipid droplets interact with each other, NS5A is recruited, which plays an important role in replication and the assembly process of the virus. The virus is also assembled in close proximity to a pathway responsible for synthesizing lipid droplets and lipoproteins. Lipoproteins are responsible for the movement of hydrophobic lipid droplets through the hydrophilic bloodstream. Hepatitis C is able to bind to the lipid droplet due to interactions at the D2 domain. Viruses bound to lipid droplets can bind to lipoproteins, forming lipoviral particles. This particle can then be transported out of the liver cells to infect new liver cells. In short, the virus is essentially exploiting our lipid metabolism to promote its own production and to be transported to new places for infection. All this could potentially be occurring within our own body without our knowledge. As the virus continues to replicate, the immune system will continue to try to remove it. Unfortunately, this leads to inflammation within the liver. Prolonged inflammation over the span of decades is what results in scarring of the liver tissue, eventually leading to cellular degeneration, known as cirrhosis of the liver. In a few cases, this virus can cause hepatocellular carcinoma, also known as liver cancer, which can be lethal. Hepatitis C infection could lead to a point where your liver is completely destroyed, resulting in liver failure. If liver damage reaches this extent, a liver transplant is the only viable option. The liver is such an important organ within the body, and this is why hepatitis C is so dangerous. Hepatitis C is a silent assassin. It is possible to be infected and go years without ever knowing. If nothing is done, the consequences can be extremely serious. So what can be done?
It is crucial to understand that therapies and treatments are dynamic within the field of medicine, and many different options have been and are continuing to be explored. One way to prevent the long-term symptoms of hepatitis C is to get tested for it. A blood check for hepatitis C can be done by looking for hepatitis C antibodies. If the test comes back positive, a follow-up liver enzyme test can be done to determine how much of the liver is affected. Once the virus has been diagnosed early, it is far easier to treat than a damaged liver. The most recent treatment includes a daily pill called Harvoni that has been known to cure the majority of its patients within 8 to 12 weeks. The administration of this drug includes combining two specific types of drugs, sofosbuvir and ledipasvir, over a 24-week period. This combination has been known to reduce the virus to undetectable levels. Although remission has been recorded to occur, relapse rates are only 5% after the 8-week treatment and even lower to 2% after 12 weeks and ultimately to 0.2% after 24 weeks. In addition, the prior treatment for chronic hepatitis C was to attack the virus with another combination of two drugs, interferon alpha and ribavirin. This combined treatment was effective 50 to 80% of the time and contained many side effects such as fatigue, anemia, and flu-like symptoms. Here at Ultratech, we try to enlighten the minds of the next generation. We hope you learned something and feel inspired to learn more. The world of science is constantly growing, and Ultratech is here to keep the scientific community updated and informed.